In this video, I'm going to present a minimalist hiking first aid kit. Now, before I get into this, I need to do a bit of a disclaimer first. I am not a doctor. Everything I'm going to tell you I believe to be correct. I have extensive first aid training. I have been wilderness first aid certified. I have been wilderness first responder certified and recertified for many years. But it is up to you to determine whether these things I'm going to talk about apply to you, are right for you. You should consult with your doctor before undergoing any kind of medical treatment or taking any over-the-counter medications. And you really should get first aid trained if you're going to be in a situation where you're going to do any of this types of things that I'm going to talk about. Now, this has been a bit of a journey for me to come to this kind of first aid kit. When I think about first aid, there's kind of three tiers to it. The first tier is the minor cuts and scrapes that you're going to encounter on a day-to-day basis. And dealing with that, is what people call like a boo-boo kit. You need, a few Band-Aids, some Moleskin for blisters, and maybe some over-the-counter medications. So that's the lowest level, the stuff that's most likely to happen but is very minor. On the other end, the top level, this sort of third tier, if you will, is serious traumatic injury, where the most common cause of death from a traumatic injury is bleeding. And there's things like the stopthebleed.org. I highly recommend going to that website and learning about how to stop traumatic bleeding. And you're talking about things like tourniquets and trauma dressings and hemostatic gauze, chest seals, all these sorts of things. Now, even treating that kind of thing, you can do that in a reasonably sized first aid kit. In fact, I'm going to show some different first aid kits in a minute and talk about why I think this particular one is important and how I kind of got to this. But in the middle, the sort of middle tier, there's where you get into like orthopedic injuries and things, and that's where all of a sudden your first aid kit starts getting huge. So let me show some examples of what I'm talking about. So first of all, I've done a video before on this kit right here. This is 6 inches by 8 inches by 4 inches. It weighs 1 pound, 15.9 ounces, or 31.9 ounces. This is a kit that I keep in my backpack and take with me when I'm traveling, if I'm going to be on an airplane, or, it's in my computer backpack. If I'm going to a business meeting, this would be in the backpack or things like this. And it's a very capable first aid kit. And I've done a video on this. I'll link to the video below. It has, a boo-boo kit. It has major traumatic bleeding capabilities, and it has some sort of middle tier orthopedic injury and injury management, gauze, and different things like that. But again, it's a big kit. Now, I have another kit that I've also done a video on before, which I'll link below, which is this kit. This is part of my modular EDC survival series. Now, this kit is much smaller. It's 4 inches by 6 inches by about 2 1/4 inches thick, and it's 10.8 ounces. So we went from 31.9 down to 10.8, so it's about a third the weight. This is a boo-boo kit and also a major trauma bleeding kit. Doesn't really have much to cover any of the middle ground kind of things. But even so, this is still, 10.8 ounces, which is pretty heavy. And it's pretty substantial. The other thing, when I talk about orthopedic injuries, the sort of interesting thing here is when I went through wilderness first aid training, we went through some extensive training in how to splint injuries. And they are very, very particular about it, right? You have to splint it so that it completely immobilizes the limb. It can't be too tight. And you're talking about if somebody has a leg injury, we're taking closed cell foam, sleeping pads, and wrapping around the leg and using trekking poles and branches and things. And one of the things that was really interesting to me was growing up, I always was interested in first aid, and I read all these books, and they always talked about, you got to have a triangle bandage. And I was always kind of like, well, what the hell do you need a triangle bandage for? Well, it turns out when you start splinting and dealing with orthopedic injuries, you want to use a triangle bandage for a sling. You want to use a triangle bandage for creating cravats that you wrap around it. And you don't need one, you need like 6 of them. In the classroom, they had like a big box full of these things, and we were using them like crazy. And even upper extremity injuries to your arms, you want like a SAM splint, and you want some of these things. So this right here is something that I put together, and I put in some of my, like a larger keep around the house first aid bag. And this is just orthopedic stuff, okay? And this is 6 by 10 by 4. It's 1 pound, 3.2 ounces, or 19.2 ounces total. And if you look in this, and this is not really the purpose of this video, but I'm just trying to make the point here. So these are a couple of, I've got 2 of these combat cravats. These are, really nice triangle bandages. Okay, if you're buying the little muslin cloth triangle bandages, throw them away. They're not going to work, and go get these. The problem with those is they're too small. We're Americans, and we're all gigantic now. And, you make a sling with it, and the person's arm's going to be stuck up underneath their jaw. And it's not going to reach around their body if you try to make a cravat with it to tie something off. So these are bigger. This is also vacuum packed and sterile. So if you wanted to use it as a large area burn dressing, you could. So I've got, 2 of these in here. And like I said, I've done splinting where I've used 4, 5, 6 of them, so that's sort of a minimalist thing. There's a couple of elastic ace bandages in here. That's a 4, this is a 6-inch. This is some KT tape, and I'm going to talk about, this is actually M tape, but it's more or less the same thing. It's athletic tape. I'm going to talk about this some more when I get into the first aid kit, but you can use this to tape up orthopedic injuries. It sticks very well to the skin, it provides support. Got a SAM splint in here, got a couple of the finger splints, and I've got 2 rolls of this cohesive tape. And I love this stuff when I'm splinting, because if you take this SAM splint and you make a splint for somebody's arm, you take this, you form it so that it has some structural rigidity, you put it up against the injury, and then you use that stuff to ramp around. It sticks to itself, and you very quickly can secure the SAM splint very well to the person that you're working on. My point in this is, just to be able to do a good job on like upper arm orthopedic injuries, you're talking about a pretty big kit. And honestly, this really does not really prepare you to handle, things that happen to a leg. Especially like if you broke a femur or something like that. So you got to make trade-offs, and you got to make decisions. And I've never made a first aid kit this small before, and I did a bunch of research. And it's really interesting how hikers approach this stuff, and they've done a bunch of kind of hacks to create this kind of capability. This is a Dyneema first aid bag. I'll have links to everything below, not affiliate links, just for your convenience. Dyneema is incredibly light. It's moisture resistant, very, very strong. And then in here I have everything in these bags. So we'll take each of these out, and we'll talk about what's in each one. Okay, so first of all, this is the tools for this kit. And I never really thought about this before this way, but this is a little Swiss Army knife. You have a pair of tweezers. You got a splinter, you got a pair of tweezers. This has a little pair of scissors in it. These are actually pretty nice scissors, and you can use these to cut bandages. It also gives you, you know, there's like a little nail file in here, and there's a knife blade in here, and you know, which are handy to have, but mainly the scissors and the tweezers in this for first aid stuff. The other thing here, this is normally a toothpick. I've actually replaced this with a ferro rod. And so you could actually use this if you wanted to start a fire. Not really a first aid thing, but nice to have. Here's some gloves. These are North American Rescue. It's a pair of nitrile gloves. These are very small. They're not very thick gloves, but you know, it's a minimalist kit. Gives you a couple of gloves. Now, you know, I showed you that big bag for orthopedic injuries. Here's the orthopedic treatment capability in this kit. So you've got a couple of 3 pieces of KT tape that I've cut that are 12 inches long. You actually only need about 10-inch strips. Like if you're going to tape up an ankle, you can tape up an ankle with like 3 10-inch strips. I added a couple extra inches because one of the other things this is really good for is it sticks really well to your skin. And if you start to get a blister, if you start to get a hot spot where a blister is forming, cut a little piece of this and stick it over the hot spot. Now the tape is against your skin, your shoes are rubbing against the tape, and you fixed the problem before you develop a blister. And then there's a couple of shorter pieces in here too. And this is good for also securing bandages. So, you know, securing gauze or something like that. So this is a multi-use item. It does all of these things for you. And this is your orthopedic capability. So, you know, this kit is really designed with the idea that you get hurt on the trail, you're going to do what you need to do to take care of yourself to get off the trail. That's what this really does. Some topical stuff in here. These are 2 triple antibiotic ointment packs. This is poison ivy soap. If you get in poison ivy, you can use that to clean it off. And there's a couple of povidone iodine wipes in here. I may swap these out. This brings up a really interesting thing. The thinking about how to deal with a cut or a scrape has really changed, right? It used to be, you know, clean it with alcohol, clean it with hydrogen peroxide, which are incredibly painful. You know, clean it with povidone iodine. I was watching a YouTube video of this hiker, and he was talking about how his daughter doesn't trust him anymore because she scraped her knee and he wiped it with alcohol. And I was thinking she shouldn't trust him anymore because he shouldn't be wiping that with alcohol. Alcohol is very corrosive to your skin. You know, it's okay to use it on intact skin, you know, if like a doctor's gonna give you a shot or something. But if you have a cut or a scrape, sure, it's gonna kill all the germs, but it's also gonna make it take longer to heal because it's gonna damage the tissue, and it's unnecessary. The sort of current thinking is, you know, rinse it out with potable water, maybe a little bit of mild soap if you have that available, and that's about it. So, you know, I have those in there. I may leave them in there. I may actually swap an alcohol pad in there just to have that in case I want to clean something off before I use it. And I'll talk about that in a second. So this is my meds. So what I have in here, I've got extra strength, or I've got Advil. Each of those packs has 2 Advil. Advil, those are 200 milligram Advils. So there's 400 milligrams in each pack. I've also got a couple of extra strength Tylenol. You can mix Tylenol and Advil together. Tylenol is metabolized in the liver, and Advil is metabolized, I think, in the kidneys. It's not the liver. And so they don't actually interfere with each other. In fact, they tend to sort of reinforce each other a little bit. So you can take them together. In fact, I'm not recommending this. You should talk to your doctor about this, but there are some wilderness first aid guides that talk about taking 4 Advils, which is 800 milligrams, and 2 extra strength Tylenol all at the same time if you had a really severe injury. Now, some people talk about Advil thinning your blood and that it could increase bleeding. It's not really clear to me that's really true, but if you're on some kind of blood thinners and things, it can make that happen more. But you definitely want to be careful. Again, talk to your doctor before you take any over-the-counter medications. But you do have an ability to sort of mix and match, and that's why I like that. This one right here is some Imodium for diarrhea. You know, diarrhea, if you get severe diarrhea and you don't get it under control, can be very dangerous because it can dehydrate you. I've got these are some Benadryls, which is the sort of old style antihistamine, but it's the sort of most powerful over-the-counter antihistamine and fastest acting. So if you have an allergic problem, those are good. Plus they can help you fall asleep, which may or may not be a good thing, depending on what you're doing. Then I've got some children Motrin chewable tablets in here. We have a 4-year-old. She loves the outdoors. And I've got some children's Benadryl in here. She's allergic to a whole bunch of stuff. And these are bare chewable children's aspirin. If you are having a heart attack and you chew these right away, it helps minimize clotting, it helps minimize the damage to your heart muscle, and it makes it much more likely that you'll have a good recovery. So surprisingly, aspirin can make a big difference in that. And then I've also got some aqua tabs in here. These are just water purification tabs, so if I needed a clean source of water. And then finally, this is kind of the boo-boo kit piece. This is a little bit of Moleskin if you get a blister. There's some 2x2 gauze pads in here. There's some Bayerdorf bandaid strips. And then this is a little bit of second skin, you know, blister pads. They're like a moist, you know, blister pad that you can put over things. And then I've got a safety pin in here. And, you know, that would be something that I would use like alcohol to clean if I was going to use it to pop a blister or something like that. So this all goes in this pack. And like I said, collectively, this is 4 inches by 7 inches by about 1 inch thick, and it only weighs 3.8 ounces. So we go from that big backpack, you know, that kit that I carry in my computer backpack, that's 31.9 ounces. The modular kit's 10.8. This is only 3.8 ounces. So, and this is, I think, a perfectly adequate, certainly for a day hike. Actually, people go out in the Appalachian Trail with kits like this, just with the idea that if something happens, they're going to get off the trail right away. Again, it's up to you to make sure this is all appropriate for you. Don't consider this medical advice. Check with your own medical professionals, do your own research, go get trained in first aid. And by the way, I strongly recommend first aid training. Go take wilderness first aid training. When you go, like I took Red Cross Basic First Aid, Red Cross Advanced First Aid. It's basically slap a Band-Aid on and call 911. When you go to these wilderness first aid, wilderness first responder, they're taking into account that you're out in the woods somewhere and you might have to take care of somebody for several days. It's a much higher level of training. And people like Solo and Knowles that do this, you know, when I did Wilderness First Responder, it was 9 consecutive days. We were there all day, and in fact, one of the days we actually did a night mock rescue in the dark in a snowstorm. We were outside treating each other as mock patients for several hours every day. I took it in January. I mean, it was like 40 below with the wind chill one day. We were out every day. Because that's the thing. In an emergency situation, you may not be in a nice, warm, well-lit conference room, you know, treating somebody. So you need to be prepared to work in the elements. And those courses teach you those kind of skills, which, in my opinion, are invaluable. If you like this video, please like and subscribe. I'm going to create a whole playlist just for first aid because I've got some other stuff to do. I do a lot of EDC kit videos, and I have several more of those that I'm planning to do. And I'm going to do some stuff on toolkits for around the house and some RV related things too, because I'm a big RV guy. So thanks for watching.